Proactive risk assessment and early detection are key to diagnosing and managing silica-related disease, especially for those in high-risk occupations. In this video, we will guide you through understanding your risk, the importance of health monitoring programs, so you can take action before the disease progresses. Understanding who is at risk for developing silica-related disease is the first step in preventing this disease. First to consider is your level of exposure. Silicosis is caused by inhaling silica dust, often found in workplaces where stone, concrete, or sand is handled. The risk increases with the level of exposure. Even if you don't work in dusty conditions every day, repeated low-level exposure over time can still be dangerous. Those who work in poorly ventilated areas or without dust control measures or proper protective equipment are at a higher risk. Secondly, certain jobs are more likely to expose workers to silica dust. High-risk occupations include stone cutters and stonemasons, workers who cut, shape, or finish stone materials. Construction workers, especially those involved in cutting, grinding, or drilling concrete, stone, or bricks. Miners and tunneling workers, particularly those working with quartz or other silica-rich materials. Manufacturing workers, those involved in the production or handling of products containing engineered stone or other silica-related material. Thirdly, it's important to consider the workplace conditions. Risk isn't just about the type of work, it's also about the environment. Poor ventilation, lack of dust control measures, and inadequate use of personal protective equipment, or PPE, can all increase the risk of developing silica-related disease. Employers have a responsibility to ensure safe working conditions, but it's also important for workers to understand and follow safety protocols. Regular screening and health monitoring programs are crucial for detecting silicosis early, as symptoms may not appear until the disease is well progressed. Screening programs are designed to catch silica-related lung damage in the early stages, often before symptoms appear. These programs are especially important for those in high-risk occupations and industries. By participating in regular screenings, workers can identify potential problems early and take steps to prevent the disease from progressing. In most states, there is regulation that requires high-risk industries to offer workplace health monitoring. If you have left employment in a high-risk industry, then it's still important to follow up with health monitoring. In this case, you may need to talk to your GP and make sure to let them know that you have been exposed to silica dust and how to access screening. Even if you feel fine, it's essential to participate in regular screening if you have worked in an occupation where you may have been exposed to silica dust. Silica-related disease can develop slowly, and early detection can make a significant difference in preventing severe lung damage. Unfortunately, by the time that symptoms appear, silica-related disease may already have significantly progressed. However, it's still important to be aware of some of the first symptoms of silica-related disease so that you can have these investigated. The earliest symptoms of silicosis can be subtle, but they should not be ignored. Common early signs include persistent cough, a cough that doesn't go away. It could be a dry, unproductive cough, or sometimes it may produce mucus. Shortness of breath, difficulty breathing or feeling out of breath, even with minimal physical activity. Chest tightness. Though not the most common symptom, some people report feeling of tightness or discomfort in the chest, which can sometimes be mistaken for other conditions. If you notice any of these symptoms, especially if you've had exposure to silica, it's important to see your GP as soon as possible. Your GP will help organize the scans and tests required. When you go to see your GP, it's helpful to bring information about your occupation, levels of exposure, and any symptoms you've experienced. This context can help your doctor make an informed decision about the need for further testing. Understanding the health monitoring process can help you prepare for what to expect. Screening for silica-related disease typically involves a combination of lung function tests and imaging studies, such as chest X-rays or CT scans. One of the most common lung function tests used in screening is spirometry, which measures how well your lungs are functioning. This test involves breathing into a device that measures the amount of air that you inhale and exhale, as well as how quickly you can do so. Imaging tests, like chest X-rays and CT scans, are used to look for signs of lung damage caused by silica exposure. These tests can reveal small nodules, scarring, or other changes in the lungs that are characteristic of silicosis. A CT scan provides a much more highly detailed image of your lungs and can detect changes far earlier than an X-ray. After the test, the doctor will review the results with you. If the tests show signs of silica-related disease, your doctor will discuss the next steps, which may include further testing, monitoring, or specific treatment. It's important to ask questions and understand what the results mean for your health. Silica-related disease is a serious health concern, but early detection through risk assessment and regular screening can make a significant difference in your long-term health. If you work in a high-risk occupation, take advantage of screening programs. Be vigilant about any symptoms you might experience, and make sure you follow up with your doctor for your results. By taking these steps, you can protect your lungs and maintain your best long-term health.